Welcome back to Breakfast on Broad. It's the big story we're talking about all morning long. Joel Embiid. Over the weekend, the Sixers announced the big man had a CT scan performed on his foot recently, and his recovery is not coming along as expected.
Okay, joining us now to give us more insight on everything from Joel Embiid's foot to his head to his body to his chest, who knows. Dr. Mark Schwartz from our sponsor, Virtua. Doc, good to see you again.
Good morning.
Thank you for joining us. So clearly, D's pretty calm about it, but a lot of folks are in panic stage over this. And they're saying, well, it's been a year. How is this thing not healed to the point where it should be? Because we were told this is a 6 to 8 month injury or 5 to 8 month injury. So should this be very alarming, or is it just kind of sometimes this happens, not everybody heals at the same rate?
Let's quickly just go to the anatomy so we know what we're talking about. I brought a model of a foot.
Yep.
And the navicular bone is actually in the midfoot, and it's what's called the keystone of the arch. So if this is the arch of the foot underneath here, the navicular bone is right at the top of that arch.
Okay.
And in a 7-foot player that weighs 250 pounds, it's prone to recurrent stress from coming down. So he had a stress fracture. Now, in a high-performance athlete, the treatment of choice generally is surgical fixation of this fracture, which he had.
Is this a common procedure? Is this?
It's not that common, but it's prevalent in tall players, particularly volleyball players, and posts and centers type players coming down.
Just to remind everybody, Doc does not treat Joel, so we're doing, just let everybody know that.
The problem is usually an operation of this sort, 85% success rate, healing usually 4 to 6 months. Now we're at 1 year, and he had a CAT scan, which shows what quoted as incomplete healing.
So why do you think now this is coming out a year later? Because he had, I believe, a scan, or he had a
CAT scan. CAT scan
March,
earlier. Yeah,
right?
in March, yep.
So wouldn't we have known this in March then?
I don't know the particulars of his case per se, but generally when we have a case like this, we follow it at regular intervals. And now we're at 1 year, and it's not unusual yet to follow up at 1 year to see exactly whether to establish that it's completely healed, especially when he's expected to return to Summer League in 3 weeks. So it's quite possible he's asymptomatic, and this was a routine finding on a routine follow-up. However, it's not a routine person, and it's not what you expect at 1 year. At 1 year, you expect it to be completely healed. So now the question is what to do next.
Well, yeah, is this just sit more, or could we be looking at another surgery? And if he has another surgery, what's the timetable then?
Well, unfortunately, in my experience, that if a fracture hasn't healed at 1 year, I'm not sure waiting any longer is going to change that. You would have hoped it would have healed by a year. So the question is what to do next. And one of the options I'm sure they're exploring right now is whether there's a value of going back in and redoing this operation.
Have you done a surgery like this and seen a similar outcome where a year later it's not healing? And if so, what's usually the cause for that?
Well, there's several causes for a fracture not healing. One of them is the fact that if it was an open fracture, this was not the case, where the bone was exposed from an accident. Another reason for a fracture not to heal is if there was an infection. Again, no evidence of an infection. Number 3 was the surgery performed properly, and I'm sure it was. I'm sure he had the best care. Number 4 was the patient compliant with his post-op regimen. I'm sure, again, he did everything he was supposed to do. Number 5, sometimes just the biology of healing doesn't occur. Sometimes the circulation to this particular bone isn't ideal, and sometimes in the process of getting a stress fracture, there's a problem with the circulation to the bone directly through the...
We heard that a lot leading up to this, and that's why a lot of teams were scared away, because that what you just mentioned, you know, with the healing process and the blood flow in there, sometimes can be a problem.
Yes, and that's why when they talked about success rate of this operation, 85%, which means 15% of the time, this fracture will not heal with a first operation. It sometimes requires a second operation.
What do you do for the second procedure?
Well, generally you do what you did the first operation, then maybe augment with some bone graft directly taken from the patient's, another portion of the patient's body to get some good bone marrow elements in there. Unfortunately, the success of a second operation isn't as high as the success of a first operation.
And then if you have the second operation, is it again another 4 to 6 month recovery?
Exactly.
So he could be out for another year.
He could be out for another year, the worst case scenario.
That's scary. That is scary stuff.
Not something Sixers fans want to hear.
Would you, now, how quickly will they make a determination here? They've had the CAT scan now. They see that it's not healing at the rate that they would like. You got to do it sooner rather than later if you're going to have an additional procedure. Wouldn't that seem to...
True. The other issue is if he's not having any symptoms whatsoever, another option is to let him try to play a little bit and see how the foot reacts, see whether he gets pain, see whether he gets swelling, see whether or not there's any deterioration of what his present condition.
But if you have him play a little bit, is there a greater risk of injuring that, of re-injury?
To some degree, yes, but at the same degree, if it hasn't healed by now, you may not change the ultimate outcome of a second operation.
Is he in better shape because he's young? In other words, we talked about Yao Ming, who was a little bit older, who really couldn't get over this. Because he's 20 years old, is this the odds better? Or does it not make any difference?
It's certainly in his favor, but it was also in his odds for this to heal the first time being 20 years old also.
Good point. Very good point. Well, Doc, well, listen, we appreciate it. Thank you very much for stopping by.
Thanks for having me on.
All right, great to see you as always. All right, it is 6:47. The